big takeaway message from this paper is that physicians are drowning in in-basket messages from patients. And the more in-basket messages physicians are receiving, the higher their risk of burnout. In addition to that, the more time we are spending in the electronic health record doing all these in-basket messages, the longer it actually takes patients to get answers to their questions. So there's a clear need for us to figure out better strategies to deal with the high volume of in-basket messages that physicians are receiving, as one of the many strategies we need to employ to mitigate the risk of burnout in physicians. So I'm Lottie Derby. When I conducted the study, I was a professor of medicine at Mayo Clinic. I am currently a professor of medicine with tenure, chief well-being officer, and senior associate dean of faculty at University of Colorado School of Medicine. So the title of the article is Relationships Between EHR-based Audit Log Data and Physician Burnout and Clinical Practice Process Measures. The article will appear in the March 2023 edition of Mayo Clinic Proceedings. So in this study, we collected what's called epic log data. So every time we as physicians go into the computer to take care of a variety of things related to patients, the electronic health record system keeps a log of what we're doing and how long we're doing various tests. So we collected this sort of what we call epic signal data on physicians in the Department of Medicine at Mayo Clinic over a 3-month time period. At the same time, we had physicians fill out surveys related to burnout and a variety of other factors. And when we connected these two databases, we could see a couple of really important things. One is that physicians are receiving many in-basket messages every day, but there's a big variability by specialists. So primary care doctors are getting many more messages than, for example, subspecialty doctors. And we found that the more in-basket messages physicians received every day, the higher their risk of burnout. In addition, we were able to look at things that also relate to the patient experience. For example, how long does it take for physicians to answer an in-basket message that's generated from a patient or that's generated from the system? We were also able to look at what kind of factors within the EPIC signal database predicts, how fast we turn around these messages, and also predicts how fast we close encounters. So when we physicians see patients, we have to make a note and then we have to sign the visit. And when we sign the visit, then patients are able to read the note. Other subspecialists, other physicians, physical therapists, members of the care team are able to read the note, and billing can happen. So it's really important that these encounters get closed quickly within, a 24-hour time period. So we wanted to see, were there factors within the signal database that predicted how fast, doctors were closing encounters or how fast we were answering patient messages. So what we found is that the more time physicians were spending doing in-basket messages, simply the longer it took for each individual message to get resolved. So we also found that the more time physicians were spending completing these in-basket messages, the fewer patient encounters got completed the same day that the visit occurred. So in terms of what this means for patients, as patients, it's really great to be able to send portal messages to physicians directly asking a variety of questions. And I think what the study means to the patients is to be selective in the messages that are sent to physicians, simply because there's such a large volume that it's really become overwhelming for the physicians and the entire care team. So for patients really to think about, is this portal the best way to communicate a need or question to the physician versus is it more appropriate to have an appointment, to think about limiting the number of in-basket messages that patients are generating to physicians, and also really, I think importantly for patients is to understand what the purpose is of the in-basket message, to make sure that the questions that are really clear so that they can be dealt with in a most effective way. So in terms of next steps. I think there are many next steps. So in our sort of quest to improve the work environment, we need to really tackle the workload that physicians and other members of the care team are taking on. And we need to monitor and respond to burnout in physicians. And one important strategy is to do, surveys asking physicians, for example, about their level of burnout. But we need to sort of couple that data with data from the electronic health record, where we can track workload, where we can track the amount of time that our physicians are spending in the electronic health record outside of time scheduled with patients. So future research needs to really explore what's the most important sort of epic signal data to track. What's going to be the most predictive of outcomes we care about, like quality, safety, patient satisfaction, physician burnout, and then figure out if we monitor, these specific variables within the epic signal database, does it ultimately lead to improvements? So that's a really important research question. So here we found that in-basket message was one of the big issues. So if we actually track that and responded to that and implemented strategies to reduce in-basket messages, does it improve the work lives of physicians? Does it improve quality and safety and retention of our talented physicians? And ultimately, importantly, does it improve the experience for our patients? So that's future research that needs to be done. So what this data really tells us all together is that we really need better systems and processes and teams to deal with this large volume of in-basket messages that physicians are receiving every day. And if we can drive those numbers down, we're likely to see improvements in burnout scores. We're likely to see improvements in how fast messages are actually responded to. So that could help improve patient satisfaction. And the quicker we're likely to see patient encounters being closed the same day. So that'll ultimately help with billing. That'll help with patient satisfaction because they can see their notes. And that'll also sort of help with, team-based care, because other members of the team would be able to see the note faster. So this paper really adds to the existing literature. It really builds our understanding of how we could potentially use data within Epic Signal to really improve our patient care. And I really hope that you'll take a few minutes to read the entire article to learn more about the nuances of the study and the future potential directions.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.